You know how crucial patient communication is when it comes to helping patients feel informed and involved. Can you explain how Trius DX Plus helps us with that?
Well, it really changes the way we communicate. With the scanner and Trios DX Plus software working together, we can actually show patients exactly what we're seeing. Things like surface caries, plaque, or gingival recession. It's no longer just us describing it, they can see it for themselves.
So instead of just saying, you have a problem, now we can visually show them exactly what's going on?
Exactly, Kanika. And that makes all the difference. It's one thing to tell a patient that they have gingival recession. It's another to show them in the DX Plus visualizations that explain what recession is, what it looks like, measure it precisely, and even color code the severity. Suddenly they understand not just that there is a problem, but how serious it is and why it matters to them.
I've definitely noticed that with patients. Plaque, for example, they often think that it's no big deal until they see it highlighted in color on a scan. Then it's like a light bulb goes off.
Absolutely. Plaque is behind so many of the problems we treat daily. It's kind of the silent troublemaker in dentistry. So when patients see exactly where it's building up and how much, it's a real motivator. Instead of just saying, hey, you need to brush better here or there, we can just show them where they need to improve their technique by showing the intraoral scans.
And I guess it also helps patients better understand the decisions behind their treatment.
Yes, absolutely. That visual confirmation is so powerful. Patients become much more, I would say, engaged in their own care. They understand not just that something needs attention, but why is it necessary? It gives context, whether it's tooth wear, brushing technique, or why certain areas are prone to plaque buildup.
That must really help with patient engagement.
It does. When patients see what's happening in their own mouth in real time by looking at the scans, they're far more likely to follow the conversation. We've actually noticed in the clinic that they ask more informed questions and want to know more. I often say the patient becomes better educated about their dental health, and I always say it boosts their dental IQ.
I love that, dental IQ. It's like the software isn't just helping with clinical work. It's helping us connect with patients on a whole new level and really helping them understand their own dental situation better.
Yes, exactly. Take tooth wear, for example. Sometimes patients have significant wear or for example, non-carious cervical lesions, but feel fine because they're asymptomatic. So they might refuse or delay treatment, like getting a protective splint or considering tissue grafting, just because they can't see the problem. But when I show them on the scans and the color mapping, they finally grasp how much enamel has been lost and why intervention is needed.
That's such a good point. I've had patients with a periodontal predisposition who need more frequent cleanings than average. They often push back on coming so often, but when they see the plaque accumulation and gingival recession right there on the screen, they understand why the case isn't just routine. It helps them understand the reasoning behind the recommendations, and it just makes the conversation so much easier.
Absolutely. Another example is patients with early surface caries. Some feel hesitant to act, especially if they don't have any pain. But when I show them those areas clearly on the scan, highlighted and color mapped, it makes the conversation much clearer and supports timely care.
And now with the patient app, it's like we are taking communication even further, right?
Exactly. Now that you mention it, after using Trios DX Plus, we can share the DX Plus visualizations directly to the patient's dental health app. What I love about this app is that it explains things in normal, patient-friendly language like what a caries is, what plaque is, or why recession matters. It also offers hygiene tips, educational resources, so the patients can learn more at home at their own pace. And the great thing is that we as doctors can choose exactly which findings we want to share from the scan in the app. In that way, we don't overwhelm, with too much information and can keep it focused on what we discussed during the consultation.
Exactly. It's a great way for patients to stay involved and take home what has been discussed. It's not just transparency, it helps bridge the gap between the clinic and their everyday routine. It feels like we are moving away from the patients just relying on what we say. Now they're seeing it, understanding it, and actively taking part in their care. Trios DX Plus and the patient app are definitely changing the game.
Absolutely, Kanika. It's helping us connect better with the patients and support clear communication.